right, my name is Dr. Ben England. I'm the CEO of Torrential Medical Education, as well as one of the co-owners and co-founders. I'm joined here today with my co-owners and co-founders, Dr. Brus Layson, as well as Dr. Raymond Butts. And we're going to be talking about emerging technology in 2026 and kind of a state of the union, if you will, in terms of adding shockwave, laser, and other multi-waveform technologies, et cetera, to your practices. And we're really going to break down 2025 and what we've heard from clinicians, from business owners, and how we're going to really put it all together moving forward and really where we stand as rehab professionals at large. So, Brus, Ray, thanks for having you guys. Appreciate you being on.
Yeah, of course.
Always good to be here.
All right, so we're going to jump right in here. Ray, obviously you've taught quite a few orthobiological hacker courses now. You've got quite a few under your belt. You've worked with everybody from special forces to just the general clinician in small town USA. What are some of the biggest things that people have asked you being on courses when it comes to technology? Are there any things that stand out to you in your mind?
I think that people are just really excited about all the different technology. They're really excited about advancing their practice, trying to find new and different ways of helping people. Sorry, guys. And really being able to help people and really get more efficient outcomes, and then also be able to expand the patients that they're able to bring into the clinic. As usual, I think the biggest thing that people ask is, about both the how and the why of all these technologies. This is really important because, all you have to do is go on Instagram and, scroll for a little bit, and you'll see that, everybody's trying to sell you the latest snake oil, the next device, what works, what's going to be the future. And so I think most people are pretty skeptical. And here we are talking about these technologies as they're going to be the future of physical therapy. And they really want to hear about the evidence. They want to understand the science. They want to really appreciate how it works. And then they want to be able to see that it's backed in the literature with good control trials and, on the same patient types that they see. And then once they appreciate that, I think their next question is, well, can we get our hands on it? Can we try it so that we at least feel comfortable with, being able to set up the equipment, being able to experience what it feels like to us so that they gain some confidence in being able to use it with lots of different patient types. And then the next question is, wow, this is amazing. And now I understand how it works. Like, what really can I do with it, right? And understanding that many of the patients that they're already seeing, that this equipment is huge and absolutely applicable, but there's a whole bunch of other patients that they're probably not seeing that they could be bringing into the practice once they are able to get this equipment. And I always make a big point of this because I think most rehab professionals, because of reimbursement and all the rest, they're trying to figure out how to grow. And I always say that, one of the things to think about is you've got to be able to provide an exceptional service. And certainly a lot of this equipment allows you to do that. But number two, you got to be able to see the patients that no one else can see, or that people are saying that they're seeing and they're trying to fake it till they make it. But you got to be able to see those guys, the ones that are getting cycled through the system. They're seeing this practitioner, that practitioner, and many of them are just resigned to live with their problem, live with their pain. When you can start opening up the floodgates on those patients, the patients with the headaches, the patients with the TMJ problems, the patients with the sexual dysfunction, pelvic floor issues, by using this technology and incorporating it into the manual therapy and the exercise that you're already doing, that's how all of a sudden you begin to expand your practice. And then you start blowing up in a way where, you're going to need to be able to train new people and have, more personnel and all the rest. So I would say those are the immediate questions, and then once they get to that point, then they start thinking about, this technology is super cool. And I see that it is not overly complicated to get it to work. Like, how can I incorporate this into my practice and not make it be this catastrophic change that's going to be disruptive? Like, what can I do to get the word out there, to be able to make this something which Patients are going to want to, come in, and I'm going to incorporate it as part of what I'm doing, but we're going to accelerate patients' programs. Do we make packages? Do we like, how do I do the business aspect of it? And honestly, I mean, that's where guys like Brus and like you, Ben, come in and really help people to be able to to make it all work. So that patients are happier and you're building value and you're building confidence, but you're also building the golden goose egg that you've been working on for all these years in a way that is really meaningful and transformative.
Yeah, Bruce, so I'm going to ask you that same question, but in a little bit different light. So you're a business owner. A lot of you may not know Bruce. Bruce has a private practice in Helena, Montana. He's crushing it. You've got quite a few therapists and some OTs and other people that work for you, and you're really just growing, scaling in small town USA. What are some of your reservations that you have as a business owner when you're talking about purchasing a 50 or 70 or $100,000 piece of equipment? Like, what are things that are going through your head? But then, second of all, what does your framework or system look like as you're trying to appraise, like, do I do this or do I not do this?
Absolutely. I mean, just to backtrack for a brief moment, then I want to hammer this question home. What Ray talked about, I appreciate the skepticism so much because
Hmm.
what we are as clinicians at heart first, right?
Yep.
And the movement science world has produced a lot of modalities over the last 20, 30 years, a lot of which, with through evidence and research, have proven to be terrible,
Yep.
right? And not effective for our patient care. But look at something like dry needling 15, 20 years ago. Only the people who were way out in left field dare dry needle their patients. How dare they do such a thing? Now, if you're not dry needling in your clinical practice as a physical therapist, as a chiropractor, you are behind. You are way behind. And the same thing is going to happen with some of this, shockwave, multi-waveform, class 4 laser stuff that's a little bit upper echelon, a little bit more expensive to play the game, but we are seeing accelerated outcomes across the board. And I'm just a true believer if we put patients first, everything else will come through and we will be successful. And I mean, doing some of this type of work and bringing some of this technology in the clinic is doing that. So I just wanted to echo that first. But from a business standpoint, I mean, yeah, you look at the numbers of some of these pieces of equipment, you're looking at 30, 40, 50, up to $60,000 for, a different type of shockwave or a laser device. And you have to wonder what your return on it is going to be. So what is the fees, writing a feasibility schedule essentially of how can I make the return on the investment, but also go beyond that and become profitable with it.
Yep.
And that feasibility schedule also obviously looks a lot different depending on if you are a cash pay practice, a more hybrid practice, or a traditional based practice. With these technologies that we're talking about, for the most part, some of them not so much, but a couple of them are not covered by health insurance.
Right.
So the traditional model, these aren't going to fit or work, or they need to adapt, and we can talk about that more later. But for the hybrid or cash model, they're going to have to look at what their offerings are going to be. Do they currently operate under a model where it's, a per service? There's a fee associated with that, or is there a global price associated with what different interventions they have at the table? And do they need to increase their prices to be able to bring new and better services to the table to get better outcomes?
Yep.
And it's all about patient education, right? If you're going to increase your prices, explaining why that is and how much better care is going to be and how much thorough it's going to be for, the different types of conditions that you're working with them with, or in general as a clinician. And our patients are smart. Like they understand what it is we're trying to do and why. And I think one of the beautiful things about Terentia and OBH and a lot of the skepticism bringing this all together is there is a lot of snake oil out there. And we have all three of us have worked incredibly hard to navigate the swamp of tomfoolery for you. There are a lot of devices, there are a lot of things out there that don't do what they say they do, or they produce bad outcomes. And we're here to tell you Here's the good, the bad, and the ugly. And here's also what's excellent and great. And this is how patients are getting better. Here's the physiology behind it, and here's the why behind it. So, if we know from the evidence that we're getting something that's good, that's going to get our patients better, great. That's step one. Step two is then build the business model around it and build a feasibility schedule to show yourself that you can make the return on it and be profitable with it too. With hybrid and traditional models, they may have to look at lost revenue if they're not billing as many units for also gained revenue. If let's say I'm getting $15 a unit, right? I don't want to charge $15 for a shockwave treatment because the cost of the shock, I'm losing money there, right? I have to be able to be scalable with it. And if we
Yep.
educate our patients and we educate our communities about what we're doing and why and the evidence and the science behind it, you know, we understand we're trying to do the right thing for people in a more effective way. So, and if we start playing the cost of healthcare perspective from a patient spend feasibility, if they're getting better faster and they're paying less copays and they're paying less toward their deductible, or in a cash pay practice, if you're paying for less visits, you're saving the patient money if they're getting better faster, and
Yep.
you're even better reputation. Then they're bringing in more business. I mean, we could spin the wheel all day. So, I mean, feasibility and making sure that's something that you can run and you can, and we're here to show you how.
Yeah, we're here to show you how, but I really want people to understand, number one, you don't have to have this technology in order to be able to take this certification or course. And we're not selling people on anything. The purpose of this certification has nothing to do with us selling you equipment and making some sort of backdoor deals with these companies. No way. Like the three of us understand. I mean, the whole reason why we got into this is we recognize that there are two ways forward when it comes to rehabilitation. No matter how you cut it, the future of rehab is going to be regenerative medicine and functional medicine. And certainly those two things go hand in hand. The point here is that we need to be able to face that fact right now and start to prepare for it. Because if we start to prepare now, right, then we're going to be the ones that are going to understand the science and going to understand the equipment and how it fits in with manual therapy and exercise well enough so that we can start to run the show. We can start to go to physicians and tell them what needs to be done with a lot of these patients that are getting orthobiological procedures or whatever it is that they're getting, right? Because we're going to be able to explain them the science as the ones that are responsible for rehab. Because if we don't do that, then in 5 years from now or 10 years from now, we're going to be managing protocols the way that we do right now for ACL patients, right? And all I want for the first time is for us to actually earn the D on the PT and to lead from the front and to prepare for the future so that in 5 or 10 years from now, that we have the chance of being the standard of conservative care, that we earn a seat at the table with the other doctorate level professions so that we can actually have that team sort of meeting and hear other perspectives and provide our own as rehab professionals so that together we can come up with the best course of action for each of the patients that we see. It's being able to provide that sort of value that's going to be able to position us in a completely different place than what we are right now, so that in 5 or 10 years from now, rehab as we know it is going to be a very different thing.
Yeah, I'm going to shift gears just a little bit. Thanks, Ray. Bruce, you mentioned fee schedules. You mentioned like feasibility studies. I spent this past weekend with dozens of practice owners from all over the United States, and one of the main things that I gleaned from it were just some of the different options that people had when it came to technologies in their business. You have the traditional, I'm going to try to sell a package of 8 lasers. Maybe there's an employee incentive program, but the problem that creates, and this is what a lot of practice owners shared with me, is a lot of employees don't want to sell anything. And it becomes this I'm selling something model, like I'm selling a tanning bed package, and patients don't really like that. So Ray, I'm going to get to dosing and like recommendations of these technologies here in a second because that'll kind of tie into like what number of sessions you're recommending. And the second thing that people are doing is, Bruce, you mentioned like a per visit thing. Some practice owners are charging $30 to $50 for a laser session, in addition to their physical therapy visit. And they're doing that as part of that patient's plan of care, and they just kind of go visit to visit, like asking the patient, like, hey, how'd you feel last time? Oh, I felt great. Well, if you want to do that again today, like it'll be $50, and they kind of get into a flow of it. I was talking to one practice owner, and he had a patient come in and just say, hey, I want to buy 50 sessions because laser was so impactful on him. And it's just sometimes the patients do lead it, but we as providers actually have a little bit of an ethical conviction of, are we recommending to people things based on what we think they can pay, which I disagree with, or are we recommending it based on the outcome that we know we can give patients? I have people all the time say, oh, I've tried Shockwave once. And I'm like, how'd you feel? Felt great. Didn't really help beyond just a couple of days. And so I don't want to do that. And I have to tell them, and Ray, you can jump in now here, is, well, based on Shockwave, like 3 to 6 sessions is pretty much the standard of before you're going to see any sort of medium to long-term outcomes, like 3 or 6 or 12 months. Like you need to be more in that window of treatments before you're going to get the long-term benefit. It can't just be a one and done, does it work or not? And we've been facing, that with dry needling for years. Is we do it once, patient feels better for 3 days, and they're like, oh, well, hey, I had to pay $30 out of my pocket or $50 out of my pocket. Felt good for a couple days, but it didn't really last. Well, most of the studies would recommend twice a week for about 6 to 8 weeks for needling before you start to see those long-term outcomes. So Ray, do you want to maybe talk a little bit about dosing in terms of number of sessions with laser and Shockwave? And then Bruce, I want to hear your thoughts about how do you then create a research-based fee schedule that could work within your clinic model?
So, I mean, look, no matter what modality that you're using, I strongly believe it's all about dose. Like it's figuring out what is the right treatment for the right patient, for the right tissue type, based on where they are in the healing process and based on whatever procedure that they got, which is everything. And I mean, let's face it, that's not always easy. I mean, the three of us have been doing this for a long time now, and I mean, the patients that I see, oftentimes I think I know the dose, and sometimes I still get it wrong. So getting it right and getting it right as quickly as possible is huge. And I think that goes back to understanding all of this different technology so that you can manipulate the variables in a way which is appropriate and meaningful so that you can get to the right dose. Now, depending on the technology that you're talking about, the variables change, right? So, for example, laser, there's a whole bunch of different variables, and there's lots of different equations where all of those variables fit so that you can actually calculate that dose. Well, what do I mean? Well, I mean, you can change the power, you can look at the irradiance, you can look at the depth of the tissue that you want to go. Then you have to look at, well, what is the tissue type that you're treating? Like how much fat is in that tissue? How much melanin is in that tissue? Is there any scar tissue or fibrosis in that tissue? Because obviously it's going to scatter the light. I mean, these are all things that you've got to be able to consider so that, you provide the right amount of power to get the appropriate amount of light into the tissue at the right depth of whatever the problem is, so that you can actually drive that physiologic change. Like, it's important to say, because I would say most of the clinics that we go into and we start talking to people about laser and I ask them what they do, I mean, the main answer that I get is, yeah, I just turn it on. And I'm like, you don't even know what laser you have. You don't know what the wattage is of that laser, meaning the power of the laser. So you don't know what the capabilities are. You really can't tell me how you're using it, like over what area you're using it. Like, I mean, these are all considerations. It's not a matter of just incorporating the technology. It's about doing it to the nth degree so that we can absolutely maximize outcomes and start to show patients a different way, right? Now, you go into Shockwave, on the other hand, well, now there's less variables. I mean, this one is a little bit more simplistic. This is where you're titrating it up to the patient's level of comfort. but you are thinking about what is the depth of tissue, how dense is the tissue that you want to treat? Is it bone? Is it the tendon osseous insertion? Is it a musculotendinous junction? Are you trying to take the inflammation out of nerves? Are you treating trigger points in muscle? I mean, these are all different variables or factors that allow me to provide the appropriate dose. But there's no way that you could possibly get the dose right unless you understand the physiology of what it is that we're doing. And unless you understand how you can change all these different variables on the equipment in order to be able to manipulate that physiology. I mean, those are just two great examples, right? So just based on that, laser, I mean, you really could do that as much as you want in order to be able to treat inflammation. I mean, you could do that multiple times a week, no problem. Taking inflammation out, making the patient feel better, particularly like your post-op patients. I mean, laser is everything, right? When you're talking about shockwave, on the other hand, according to the literature, 1 treatment per week, awesome. 2 treatments per week, legit. 3 treatments, not good. In
Right.
fact, 3 treatments per week actually makes it worse,
Yep.
right? So, I mean, that's just one example of why you need to know how all this stuff works. What is the difference in the physiology of all of this stuff so that you can not only apply it, but you can apply it in an appropriate way, in a maximal way, right? In all of the different patient types that we see.
And then in terms of exercise, Ray, to your point, like anytime you're exercising using multi-waveform direct current devices, you could do every time. To tie it kind of back into what Bruce, the question that I asked you, kind of an interesting concept. I met providers this weekend that are actually charging for multi-waveform devices. ARPWave, Newbie, like they're doing exercise sessions where they're charging with the device. I use it as a sunk cost in my practice where it's just part of my session, anytime I exercise. But it was interesting that patients saw the difference of using the device with exercise and they saw the outcome and they're like, oh man, like I want to do this like 3 days a week on top of my workout program, almost like medical fitness when I'm done with my rehab. And I loved that idea. So with what Ray said about, hey, you can use laser at every session with your plan of care being 2 to 3 times a week for maybe 4 to 6 weeks, your shockwave being maybe 1 to 2 times a week for 4 to 6 weeks. How would you go about building that in a hybrid practice, maybe in a cash practice? Like, what are your thoughts as a business owner?
Yeah, I mean, there's your imagination is the only limitation, right? Or lack thereof, I should say. You know, there's so many different models out there that exist, like, like you're running kind of a sunk cost that's built in. You have a lot of different options to use for your patients, and it doesn't matter what you use or not use, like that's what the
Yep.
cost of your visits is. And it's a little bit more because you've got a lot of different things on your tool belt as that you can use, right? Versus there are other models out there that exist in the United States and other countries too that, it's more fee for of individual services, right?
Mhm.
Either work as long as feasibility schedules are made and they're demonstrated to show that there's a return in the investment and hopefully with some profit margin. You got to
Yep.
base that feasibility depending on the percent profit margin that you want and what your expenses are, right? From a, personally, you talked about like, selling. I don't want my staff to sell anything. I'll talk a
Right.
little personal philosophy here. I have physical therapists and occupational therapists that work here at Advocate Physical Therapy. They're not involved in knowing what the cash rate is for that patient, of what the copay is for that patient, what the deductible is that they have to pay toward till a certain percent out of pocket max is met, blah blah. Doesn't matter.
Yep.
Their job is to provide the best walking hits of what's evidence based to that patient based upon what they have going on. And the biggest problem is, especially when it comes to this new age stuff, is that we're not educated. We don't know. Someone has plantar fasciitis. I'm doing some of my other stuff that's great, but I want to be able to bring something like extracorporeal shockwave therapy into the mix. Well, what's the literature say? 2 treatments, once every 2 weeks. Is that it? Do I see him 30 times for shockwave? 3 times a week, 4 times a week? Just really get after this thing. If we understand the physiology and we understand the science and we understand the literature and we look through, plantar fasciitis cases based upon an average of, their pain being this is how many appointments that we should see. That's what our clinicians' recommendations are going to be. Sometimes it's a little bit less, sometimes it's a little bit more, but we're not taking really the finances into consideration. If some patients can afford it, great. If they can't, that's okay. We'll continue to provide other services to help them move in the
Yep.
right direction. But the offer is always going to be here's what we have at our disposal to help you based upon what your experience is and what the current body of evidence literature is. This is the plan of care that I recommend that I think will help you.
And plantar
And
fasciitis is the perfect example. That's the best example because you really know what is the most evidence-based thing for plantar fasciitis. If I asked you, is it low intensity shockwave? Is it moderate intensity shockwave, or should it be high intensity? I mean, you'd guess high intensity, right? The truth of the matter is it's moderate intensity. The
Yep.
low isn't enough. The moderate is too much, and the perfect sort of a dose for most patients is up in that moderate range, right? But if you're just turning it on and doing it because you have something which is new and shiny and sexy in the clinic, like that's the point, is we have to be able to demonstrate better value instead of selling patients things so that they're willing to pay because they want to feel better and they want it to be fast and it is worth their time and money.
then
Yep.
understand the physiology behind it, what we're actually doing, and be able to have that conversation with patients, but also clinicians. They take an x-ray and they find a calcaneal heel spur there in the plantar fascia, and we're going to blast away that bone spur. They go get an x-ray 4 weeks later. What do they find, Ray?
Yeah, they find that the bone spur is still there
And
because
it's sometimes worse from
Yep.
an
that's right.
imaging from an
You
imaging
actually
perspective.
you actually increase the bone mineral density of that heel spur. In that way, you almost using shockwave and reinforcing the heel spur instead of getting the body to reabsorb it or to disintegrate it or whatever it else a lot of the physicians are saying. I mean, that is just simply not the case.
But
I
it's
mean,
not as painful. Why?
well, it's painful because everybody thinks they need to disintegrate that heel spur by using very high intensity sort of shockwave instead of thinking about it in more of a moderate intensity way because you're trying to change the relationship of the physiology of the bone's connection to the tendon or to the fascia in this case. Like
Yep.
that is the connection which is driving that inflammatory response and pain. But there's no way that you would know that unless you understood the physiology of the tool that we're using and actually what the research said, which is the whole point of what we're trying to bring to market and how we're trying to change the profession when it comes to orthobiological hacker certification.
So I
So
want to.
that's the thing, Ben, is that the recommendation is packages may work in some markets, in some towns, and in some clinics, and sometimes packages don't work.
Right.
In a hybrid or a traditional model, like that may not fly. But I mean, it's very dependent on this. As long as as the feasibility studies pencil out, then yeah, run it, get the ROI on it. But at the end of the day, like I've said this already once, if we put patients first and what's out there, that's all that matters. And then, the return on investment's going to come with that. It's
Yep.
just, versus something like dry needling, which again, we were resistance enough as a rehab professional, world against, which the, initial investment to buy a stim unit and buy a couple of needles, that investment is small, but now everyone's doing it, everyone's fine. We're, unfortunately with some of these technologies, the investment's a lot larger. And so, we see that as a bit of a gamble. In reality, it's not. Pencil it, work it, see what your price is going to be, and see that this stuff is not only going to get your patients better, it's actually going to make you more money too. And they get better faster, and you see you get to help more people. I mean,
Yep.
I mean, when students ask me these questions on courses, I'll be honest with you guys. I tell Ben stories. I mean, Ben, I think the most powerful thing is for students to hear, number one, what it is that you purchased in order to upgrade your practice, which was the first regenerative medicine practice in the country.
Yep.
Number two, how much you really paid per month in order to be able to have that
Mhm.
equipment. Number three, how long it took you to pay that equipment off. And number four, how quickly you increase the number of patients that you were able to see and bill for services in order to be able to pay off that equipment.
Yeah, so I'm going to give some really, really real and practical numbers. I mean, I literally pulled out my calculator here to do that, Ray. So I want to kind of break this down for most people. Most of your devices, let's just use for simplicity, $50,000 per device. What that equates to is about a $900 to $1,000 a month payment for 60 months, which is essentially a car payment, right? If you look at laser, for example, if you take laser and let's say you charged $50, for your laser, how many treatments do you have to do, in essence to pay off your device? Well, it's roughly what? How many do you got to pay off? You got your $50,000, you're going to divide it by your $50 for treatments. That's about 1,000 treatments that you have to do. If you see 2,000 patients per year, assuming you work a 40-hour work week, one patient an hour, and half of your patients opt into laser, well, then that's $50 per session. Your device is paid for in 12 months. If you have only 500 patients do it, it's going to take you 2 years. You're making your payments, but the device is paid off. And then every year after that, it's $50 per treatment that it's making your clinic. With Shockwave, you've got some other things to consider because laser doesn't have as much maintenance, if any maintenance at all. You're limited by the number of shocks that you get before the coils have to be serviced and recharged. Okay. You get about 2 million shocks with most Shockwave devices. So if your device was $50,000 and an average treatment, Ray, is about maybe $4,000 or sorry, 4,000 shocks per area, right, that you might be treating. That's
Sure.
about, in terms of numbers, that's about 500 treatments in essence, that you get out of that Shockwave device before you have to recharge it. But if you do 500 treatments at $100 per Shockwave treatment, that's your $50,000 for your device, and now it's paid for. Okay, do those numbers kind of make sense, guys? And one of the
Yeah.
things to think about is, we bought a laser and a Shockwave and put them in our clinic immediately. Like we put them both in there at the Regen Med clinic that I was at. My schedule within about 2 weeks was just laser and Shockwave. Like I couldn't even get physical therapy patients in to the clinic. So what we did was we hired a tech, check your state practice act, like Bruce, I know in Montana you guys have some legalities and things that you have to
Well, every
consider
state
about.
practice act is a gray area, right? And what
Yep.
is considered a physical therapy service and what is not,
Yep.
right? Some states, a shockwave or a laser treatment may be considered a physical therapy service. It needs to be provided by a PT or a PTA, and that's fine. There's other, do you need to create a separate corporation to do some of these things? Or is it not considered a PT service and it's okay for a technologist or someone with on job or on site, or they go to an OBH class and receive training? All
Yep.
great questions, very state by state dependent. Call your individual board of examiners or licensors to get clarification.
Yep. And so what we did is we ended up hiring a shockwave and laser tech. And to give you guys an idea, our treatments would take about 20 minutes. That was what we did, 20 minutes, so 3 treatments an hour. That was about 120 treatments a week. We did 50 for laser, 100 for shockwave. Let's average it at $75 per session. That was 9 grand a week. So to give you an idea, in 12 weeks, of doing that, we were at $108,000 in revenue, $75 times 120 visits a week times 12 weeks. We were at almost 110K. We doubled our revenue from our investment. And something to think about, like when you have a practice or you have an area where, you have a large volume of patients, like Bruce, like we've talked about, maybe, you maybe add some laser, coming up, right? In addition to shockwave. Like if you add laser to your clinic and all of a sudden, every one of your therapists, in a week, let's say you have 10 therapists and they're all recommending laser, and you're going to be in a situation that maybe one of your full-time staff is just doing that one modality or service. And if that individual doesn't take away from your physical therapy practice, or maybe you have a designated physical therapy assistant that carries out that task, well, with $108,000, you can pay for the device and somebody's salary to run it for the year. And then after that, it's literally just 50% is going towards a salary, 50% is going towards revenue. So there's a lot of different ways you can do it. But I mean, We did it in 3 months, and even this, last clinic, my newest endeavor, I'm using all cash, all my technology is included, but in terms of revenue, like it was paid for within a quarter. I mean, you are very well able to do it if you understand how to incorporate it into your existing plans of care. And it really is simple. And, back to the staff selling point is it's not about getting your staff to sell. Bruce, I agree with you. Ray, I agree with you that it's about getting your staff to understand what the research says. And for acute, subacute, and chronic conditions, what are the recommendations for each modality? Bruce, office managers, back end, workers deciding what that fee schedule is. And if a patient can't afford it, so be it. The therapist still is going to make the recommendation because they're going to do their job. You got to be careful. Like, don't profile your patients of whether or not they can afford it or not, because if people want to get better, they're going to pay whatever it costs to get better. And something I say in my clinic, we have a money back guarantee. If you're not feeling a difference within 2 weeks, I'll give you your money back. Is patients are paying for the outcome. I had a patient come in, I literally saw him today and he came in and he goes, I've had back pain for 20 years and that shockwave thing is bleep magic. you know, I mean, he was like, I haven't had back pain since the 10 days ago when I saw you. And he goes, "Can you look at this elbow? Hey, I've got this finger like trigger thing going." Like, I mean, he was just like, "Can you use it here? Can you use it here?" I mean, he was just like, and he was like maybe an individual that I thought, maybe could not afford it. Like we had to have that discussion. He wanted to go 10 days apart with his sessions, and I totally respect that. But I bring that up in terms of he's now going, can you see me tomorrow for this? Like today, can we take care of this? Can we do my back again today? And he saw the value in it instantly. He's like, can I come 5 days this week? I'm like, let's pump the brakes, buddy. But like,
That now it's your job to ethically backpedal the other way too, right?
right, I've got to tell him what's
And we see
reasonable.
that. Let's talk about the research. Yeah, exactly. If we just
The-
and guess what, he's going to respect you even more for that too, right? Because
Yep.
he's like, oh,
with
this guy isn't about generating a bottom line. He's about helping me get better. Which then, what do you know, cycles back on itself. If we put patients first, the ROIs come with it.
it
Truly.
is worth saying that Ben's story is incredible. I think it is also worth saying that it's even more incredible considering that Ben lives in northern Indiana, which is, not the wealthiest place in the United States, right? Like now consider what Ben told you and now change it to a different place. Like I live in Miami, right? Where this is the land of wealth and privilege, right? And I think it's important that you understand, like, I mean, I'm charging for services in a very different way than Ben is. So it is really based on, the location, the context in which you live. I also get asked by a lot of students, well, I don't have a clinic, right? Like, so how am I going to have why am I going to even think about this technology? Like, it's just not in the cards for me. Understand, guys, like, I bring shockwave and laser right into people's living rooms. I mean, all the time. I have a little clown cart that I take. The number one question that I get is, "Did you bring the whole clinic with you?" And I'm like, "Uh-huh." and people love it, And a lot of the people here in Miami, I mean, they obviously have more money. And yeah, you show them the value in treating one thing, and then it turns out they have another five things that they want treated. I mean, the number of patients, I don't just go for 1 hour, like I go for 2 or 3 hours, right? Because they want to do this, they want to do that. And you're right, like in many cases, it is fair to pump your brakes and let's space it out a little bit. Let's focus on one thing at a time. But my point is Ben is he's really talking on the low end of things. Like he's really talking about it in an ultra conservative sort of way, right? No pun intended, he's in Indiana. But like like the sky is the limit in terms of what Ben is talking about, right? Because it could really be an exponential, much more exponential than what Ben is describing to get stuff paid off and start turning it into revenue.
Yeah. So I'm going to ask just, a couple of questions before we close. Bruce, what are some things that you think are actionable in terms of, clinicians as they're weighing, and I should say really business owners, as they're weighing the purchase of a device this year. I mean, we know where the fee schedule's at. We know where the cuts are. I mean, everybody's kind of running on razor thin margins. I mean, I heard the lowest from any practice. I talked to a guy this weekend and he was running a 3% margin. He added cash services just to help pay, his own salary. And he's got like 5 clinics, so what are some things from a business owner's perspective? Like if you're like, okay, what do I need to do this? Like, what are the steps to take?
Well, traditional practices alone will not survive. There is no one coming to save us. There's
Yep.
no one coming to save you. As soon as we recognize that and unite together to move forward, that's step one, is recognizing that. Step two, if you live somewhere where you're not getting paid $5 a treatment, like some states, and can work with insurances that allows you to pay staff and be able to grow and to have expenses, great. You can utilize health insurances if you want to deal with the headache of dealing with payers and credentialing and contracting and all EOBs, all that fun stuff. But regardless, even so, the traditional practice will not survive. You must, in 2026, have multiple income verticals. There's a lot of ways in which this can be achieved, but you have to make the decision of what niche, of what practice, of whatever you're going to be. You must have a multiple income vertical, a lot of which is cash pay services. If you are having insurance patients in your clinic and you are a little bit more traditional in that aspect, that's totally fine. I respect that. My office is the same way, but we do have cash pay services here in the clinic that is in conjunction with what we are getting for those payers. They are not coming from the payers, they are coming straight from the patient based upon plan of care recommendations for what they have going on. Do I ever get pushback from patients? Yeah, I would say only 5% of the time, most of which just want a little bit more education and understanding. And we come to an agreement and we go from there. Very rarely do I have someone flat out say, I just can't afford to do that. Does it happen? Sure. And I say, hey, that's totally fine. I wanted to make this recommendation because I think it'll help you get faster, but I do have some other tools at my disposal to try to help move us in the right direction. Does that happen? Of course. But I'm making the recommendation based upon what is there going on. So how you go about doing that, you have to look at the clinical side of things. What are the type of patients that you're treating? What are the populations? What are the conditions? Are you more of a are you someone with a subspecialty, craniofacial, vestibular, cervicogenic, population? You know, okay, maybe with that population, I really want to work on the types of technology I want to incorporate is more multi-waveforms or galvanic vestibular stimulation. Am I working with a lot of like, if am I in Miami and I'm getting a lot of PRP and BMAC and Lysate and all of this upper echelon stuff? Okay, I definitely want more of a shockwave and a laser, right? I think are you seeing a lot of post-op? What modality that can I bring to help increase income verticals, be able to pay staff more and cover expenses more? If I'm seeing tons of post-op patients, if I had to pick one to start off with, what's it going to be? For me, probably a laser, right? I'm helping with inflammation, getting joint range of motion better, faster. I'm helping them produce pain-free contractions and strength quicker. That's wonderful. Making that choice. I personally, unless you're daddy fun bucks and you've got the money to spend, go for it. But taking on one of these pieces at a time, you see, wow, I made that return in 3 months, 6 months, a year. Let's continue to grow. Let's bring in another piece. Let's have another income vertical. Let's have another income vertical. And some patients maybe they're doing a couple of these at the same time. Maybe you're doing some traditional stuff, but they're doing one of these at the same time because you see that's what's best for them. I think looking at your populations and looking at what you're doing clinically first as a clinician, and then bringing the business aspect of that is the way to get started. How do you eat an elephant? One bite at a time, right?
Yep.
Yeah. And at the end of the day, I mean, I think it's important to say, we talk a lot about technology, right? Because many of these things are the way of the future. But at no point do we ever advocate just giving up everything that we do and just start using technology. It's not
Right.
about that. Like
Yep.
what we're really advocating are treatments that are multimodal and multidisciplinary, right? And really consider using exercise, putting it together with manual therapy, and then adding some functional medicine in order to control what's going on systemically, and then add in some of this technology in a way that's appropriate in order to add value to what it is that we do. I mean, at the end of the day, guys, I mean, this is a legacy thing for us, but I know that this really hits home for most rehab professionals. All we want is for rehab to be more than what it is right now. Not have that feeling like our hands are tied all the time. Not have that feeling like, I wish I just had a little bit more time, a little bit more skill, a little bit more tools. Like that there, you left something on the table where you could have helped the patient, but you didn't know how, or you couldn't for whatever reason. Like all we want to do is elevate what it is that we all do to take it to the next level so
Yep.
that in 5, 10, 15 years, we're in a uniquely different position so that we can actually start to be the leaders of rehabilitation so that instead of us going out and begging patients to come to the clinic or trying to convince physicians to refer patients to us, right? I want patients to start to look for us. I want patients to look for you because your outcomes are different, the patients that you're able to see are different, and that the product that you're providing is exceptional compared to everyone else in town.
We're practicing at the top of our scope, and this is helping us expand our scope in a way that we already know how to do, but
Yep.
it's in conjunction. We're not saying, I don't want any clinician to be subscribing to a philosophy. I shockwave every patient that comes in. I dry needle every patient that comes in. I crack and manipulate every patient that comes in. I get the barbell out and I deadlift and I push the sled. I load that tissue with every patient that comes in the door. All those things are great. It takes skill to be able to know when and when not to do something, when to combine this treatment with that treatment, when to bring in nutrition, when to bring in supplementation, when to bring in these different treatments, and when to stack them and how not to stack them, and what to do and what not to do. All of this is practicing at the top of our scope. We have all these different tools at our disposal, but the biggest and best tool is your brain. You have to know what to do, when to do, and why to do it. That's what makes us rehab professionals. That's what makes us the best at what we do. But we're trying to expand that scope and what we're capable of doing with these patients. And one of those things that we have not touched with a 10-foot pole in the last 40 years is regenerative medicine. And here we are. We're doing it. We're leading the charge.
I mean, and this is just one example, right? Like, I mean, regenerative medicine is the way of the future, and certainly it is a patient type that there's an awful lot of people that are out there trying to fake it till they make it.
Hmm.
But I think all we're saying is that if we can practice at the very peak or top of our scope of practice, then if we can show value in that, if we can do that really, really well, then the real question is, can we earn the ability at some point to be able to do more, to have a bigger impact, to be able to play a bigger role? They're already doing it in the military, so why not us? All I want to do is to be able to earn the ability to be able to study the things, get the tools, whatever it is, in order to be able to have a bigger impact in patients' lives than what we do right now. There is no reason why that can't be us.
It has to be us. It has to be us. With the healthcare provider shortage that's happening around the world, not just in the United States, someone has to step up and answer the call. And
I
that's
know
what
people are frustrated. I know people are dying to think outside the box. I know people are dying for change. Well, this is thinking outside the box. This is change. Let's just do it in a purposeful way. Let's do it together. Let's elevate the standard.
Well, thanks for hopping on this call, guys. I really do appreciate it. If you want to know more, go to Terentia.com. Please feel free to look at our website, look at our upcoming courses. If you're in the Terentia tribe, which would be you guys right now, make sure that you follow us on social. Follow us on Instagram, check out our YouTube channel. We're constantly going to be putting new content up here for 2026. I'm going to do something a little bit unconventional for those of you who are listening to this right now in the tribe. Email Bruce at Terentia.com for a special 2026 discount code. for being in the tribe. So be making sure that you get an email out to Bruce if you want to attend an OBH course this year. We'd love to see you there. We're super excited for you to be on here, but we'll look forward to seeing you next time. Thanks, guys.
Thanks, guys.